Abby Hinz is a nurse practitioner with the Eau Claire City County Health Department, ECCCH. Is that what y'all say? Yeah. She splits her time between providing sexual health reproductive services in 5 different counties, student coordination, and nursing practice support. Abby started at Eau Claire City County Health Department 12 years ago and has worked in most roles that a public health nurse can work, including communicable disease surveillance, immunization, and maternal child home visiting. Her passion for collaboration with community partners started with coalition work that focused on healthy relationships and LGBTQ plus health. And we have Anni Hedlund. Anni is a program specialist and Spanish interpreter at Eau Claire City County Health Department. She works closely with clients to enroll them in coverage programs like FPAWS or Family Planning Only Services and Badger Care. And she serves as the coordinator for the Wisconsin Well Woman Program, WWWP. In this role, she assists clinic clients with enrollment, connects them with resources both within and outside the clinic, and collaborates closely with providers to facilitate referrals to partnering clinics in the area. Anni also serves as a Spanish interpreter for the Family Planning Clinic and uses her Spanish language skills to support WWWP clients. Additionally, she completes all STI, chlamydia, and gonorrhea follow-ups within the WED system. She works collaboratively with other divisions within the health department by translating documents and providing interpretation services such as tuberculosis follow-up and immunization clinics. She's deeply passionate about connecting clients, especially those in vulnerable situations, to the care and resources they need. Now, I will hand it over to Anni and Abby. Thank y'all for being here.
All right. Thank you, Adele. It's been a long time since I had to speak into a microphone. So if you can't hear me in person or online, just let us know. My name is Abby. I am a nurse practitioner. Like Adele said, I have been with the health department for about 12 years now. And yeah, that's me. I think Adele really kind of covered everything, and I'll let Anni do a quick intro too.
Yeah, my name is Anni Hedlund. I started as a intern at the health department back in 2021, and then I ended up staying and transitioned into my position now with being a program specialist and then a Spanish interpreter. So yeah.
Yes. So although we are here talking about building community partnerships in public health, we know that all of you have experience doing this as well. So we were really confident in adding in some like engagement participation, which maybe that'll go okay, maybe it won't. We'll see. We're going to hopefully try and use Mentimeter, which is an online engagement tool. Some of you are probably familiar with it. So when it comes to those questions, you'll see us like running back and forth to the computer. And if it's really not working, we'll just bag it and we'll just talk freely and ask those questions just in real life, I guess. So to get us started, Anni will kick us off.
So before we dive in, we did want to just briefly go over all of our learning objectives, what we want to share with you guys today. So we'll start by talking about the motivation for identifying our community partners and how to serve our priority populations. From there, we'll look at different types of organizations in our communities that are already doing this work and then how they support populations we care about most. We'll also share practical strategies for developing partnerships and just as importantly, sustaining them over time. We'll discuss the real impact these partnerships can have, not just on services, but organizations themselves and the broader community. And then finally, we will wrap up with best practices for forming these public health partnerships that you can take back and apply with your own work. And we just wanted to share a little bit about our demographics and where we are located in Wisconsin. So we are a city county health department, both serving the city and the county. County population at about 108,000, our city population at 72,330. So we're situated along 2 major roadways connecting to the larger metropolitan areas, the cities of St. Paul, and then also via Interstate 94 with Madison. We have our team here. So We are made up of nurse practitioners, nurses, program specialists, a community health worker, and our division manager. We're lucky to have a team that shares the same goal, wanting the best for our clients and working together with community partners to be able to do that. So Abby and I, we also have Gina, Gracie, Janelle, Sheila, and Stevie.
So, okay, so here goes the technology. So get out your devices, your phone or your computer. And I'm gonna try and get over to the Mentimeter here. Our first question is coming up here. So you can either use the QR code, or if you go to menti.com, you can type in that code you see on the right side of the screen. And so we just want you to start thinking about what motivates you in all of your work to partner with community partners. Yeah, so a lot of times the relationships, hopefully in an ideal world, will be mutually beneficial, right? Expertise and passion. Yes, there are a lot of people that work in our communities that have other expertise that we do not have. Yes, these are all honestly the things that we are going to be echoing throughout the rest of the presentation. Can you scroll down? Yeah. Oops. Maybe we lost some. Yes. Broaden our reach, have better outcomes, address patient needs. Yes, all of these things are really kind of exactly what we are going to be talking about. Oh yes, I love avoid reinventing the wheel and duplicating work. That happens so frequently in our community as well. So, all right, all great, perfect. So we can hop back to the presentation. All right, so why community partnerships? So this is really, again, this is gonna be a repeat of what you all just said. Our clients, our communities have complex needs, and as a health department, we cannot address all of those needs. And we need a network of resources to help do this. And then when it comes to connecting our clients to those resources, it can be complicated. Our healthcare systems are not easy to navigate. So we want to be there to hopefully help connect those dots between our clients and the community and the resources that are available. We know that we can't do it all on our own. We all wish we could, but we don't all have the time, the capacity, the energy, the funding to do all of these things. So knowing that we can't do that and we have to work with our partners, helping us avoid duplicating services and using our resources wisely, especially with public health right now. Funding is, not what it used to be. So making sure that we are using the resources that we have and that our community partners have wisely. And then knowing too that there are so many organizations in our communities that are doing really good work that align with our values. And so how can we work together and broaden our reach and just amplify the work that we are all doing? So these are the types of community partners that we work with. Oh, sorry, I'm not even talking into the microphone. Can you guys hear me online? Okay. They're all good. Okay. Well, I'm not going to talk into it then if I don't have to. Oh, ooh. Okay. Okay. Sorry, guys, online. Okay. So how we kind of prioritize our community partners is really focusing on who are they working with, the populations that our partners serve, and making sure they align with the priority populations we serve, and then focusing on underserved populations as well. So a lot of our work, I think you heard earlier, a lot of the STI rates are among young people. And so that's one of the reasons why that is a huge focus of our community partnerships is accessing young people and working with young people, people that are in college or college age people, people that are uninsured or underinsured, people facing other socioeconomic barriers, including homelessness, transportation, things like that. And also people that identify as LGBTQ+. So I'm going to kind of talk through some of the partners that we have in each of these areas, as well as other partners in our community that have shared goals. And a lot of times they are also serving these priority populations as well. Ooh, another Mentimeter question. So we will flip back to that screen. So just think a little bit about your community and what organizations are in your community, and either you can name a specific organization or a type of organization that works with a priority population in your community. And this could be someone you're already partnering with, or this could be someone, an organization that you're hoping to partner with. Schools, yes. Planned Parenthood, libraries. Yeah, schools is a big one in our community too, that's for sure. Free clinics, food banks, federally qualified health centers. We have a newer federally qualified health center in our region as well, and we're really kind of just trying to establish that relationship, which Annie is going to talk about a little bit later. High school nurses, I'm going to talk a little bit about that. Yeah, so these are all really great organizations or types of organizations that are in many different communities. Annie, if you want to switch back. Okay, so I'm gonna start with talking a little bit about the youth serving partners that we have worked with over the years and kind of how we built those relationships over time and how those relationships have changed over time. So in our county, we have our main school district is the Eau Claire School District, but we also have some more rural communities with their own school districts as well. In our Eau Claire area school district, our public health nurses actually used to be the school nurses. So there was like a really strong natural partnership there, right? Because they were actually working in the schools on a regular basis. We are no longer doing that, thankfully. That would be a lot of work. So that relationship has changed over time, and I'm sure a lot of you probably experienced this too. It changed a lot during COVID as well. So I think we're on a trajectory right now with our school districts where we're kind of rebuilding those relationships and really putting in the time, the effort, and the work to get them to be in a place where we feel like confident with the partnerships that we have. In our Eau Claire area school district, we are providing on-site reproductive and sexual health services, which is wonderful. I would say the biggest thing that has made that successful is having a champion in the school. So in one of our schools, it's the school nurse. She reaches out to me when there's a student that has questions, and we also work with some of like their support staff. And so just building those relationships, meeting them, they know your name, they know your face, they're more likely to reach out to you. And so I think with the Eau Claire area school district, that's been our biggest thing, is like knowing the people there, meeting the staff there, and just getting to know them and having that established relationship. At the Eau Claire area school district as well, we do like sex ed in the classes. So the teachers have their whole human growth and development curriculum, and we just come in for one day of that. And so that's really awesome because again, then the students at a bigger level are seeing our faces, and we're talking about STIs, we're talking about contraception, but we're also letting them know that we are available and what's in the community, what resources do we have in the community for them to access confidentially. So that's the other important thing about that connection with the schools. With Altoona School District, that's one of our smaller school districts. that has been a relationship that's been a little more, I would say, up and down. And for different reasons, and none of them good or bad. It's changed over the years. One of the cool things that I'd like to highlight is I think it was like 3 years ago, we started doing that health class sex ed presentation. And since that time, they invited us to their human growth and development committee, which felt like a really huge win for us. And that was really exciting. And with the Altoona School District, I would say the champion that got us in, like that was the only way we were getting into that school. And it was because a social worker that used to work for our county, DHS, our Department of Human Services, got a job in the Altoona School District as a social worker. And she was like, come on over, come in, talk to our administration. And then that was kind of our in the door. And so that was a huge, again, that's been kind of a huge win over the last few years, is building that relationship. Life Without Limits is a program within the Eau Claire Area School District for young people transitioning from high school to adulthood. And these are young people that have disabilities, mostly I would say invisible disabilities, but we come in as just a piece of the puzzle with them, and we talk about sexual health. And this is one of the groups where with the youth, we actually bring them to our clinic. They do a tour of our clinic so they can see our space, so that they can be comfortable knowing where they're going if they need reproductive health services. And again, it's just kind of being that face and the place to what is this family planning clinic, so they can feel more comfortable and confident when accessing resources. Power Perception is another youth serving organization, and it's mentorship for African American and biracial youth in our community. And again, we've done some kind of like sex ed programming with them, and also like the clinic tour, all of that. And then they were a good example. They were already partnering with some of our coworkers at the health department, and one of the coworkers was like, hey, you should probably meet this person, because I think you guys could do some stuff together. I think that there could be a collaboration here. So that was another way that we try and leverage our like already established relationships in the community to continue the work that both of our organizations are doing. We also happen to be in the same building as the Northwest Regional Juvenile Detention Center, which is obviously good and bad. But it has allowed us to have a natural partnership again over the years, because we are in the same building. In the past, we have had funding that has allowed us to do more adolescent health and more sexual health and sexual violence prevention work. Currently, we don't have any grant funding specifically to do that, which is, again, another one of those places where those partnerships kind of ebb and flow. Do you have the funding to do the work? Do you not? So our current partnership with the Juvenile Detention Center, I would say, isn't as involved, because we don't have that funding. We don't have the capacity to do all of that education, but we are able to go provide services up from juvenile detention. And again, that would be another thing where we have good relationships with some of their staff. So having those relationships with the staff is so key to making sure that people are getting connected to your services. And the same thing with the Western Dairyland Fresh Start program. It's an AmeriCorps based program where you sign up for a year-long AmeriCorps term, and over that, of course, that time they actually get to build a house, which is really cool. This was affected by some of the funding cuts to AmeriCorps in Wisconsin, and so they're in a rebuilding phase right now too. But this has been a really great relationship, because we also do so much other work with Western Dairyland, because they are an economic assistance program in our community. Okay, so our community has a couple different like higher education organizations, one being the University of Wisconsin-Eau Claire. And I would say, I mean, both me and Annie went to UW-Eau Claire, so we have that connection with the university. But as you can see, we have partnered with so many different programs and departments within the university, and those partnerships have done a whole lot of different things. Some of them are working directly with students. So we have nursing students that come to our clinic, do their clinical rotations there. So the race, ethnicity, gender, and sexuality studies program, they have capstone students that work with us. And so really this partnership has been doing a lot of community outreach. And also how are we serving the young people on campus? So some of the events that we've partnered on over the last several years is they do a big drag show in February. And that has been a really wonderful way for not only campus, but our larger community to be in a space that's affirming and welcoming. And we've been able to do some outreach at that event. We do sexual health resource fair, UWMTC, the cookout, and National Coming Out Day. We table at all of those events. And I'm gonna skip ahead because we have some fun pictures. Everyone loves pictures. So this picture on, I'm sorry, I'm not by the microphone again. The picture on the right there is of Annie and Allison. Allison is one of our public health nurses. This was tabling at the Sexual Health Resource Fair. And that's actually when we had MPOX funding. So we were able to bring MPOX vaccine to campus for people to get vaccinated. Outreach vaccination like this doesn't always go great. People don't really want to walk to class and get a vaccination, but we were also providing a lot of education. And as you can see, we try and have fun swag too that we bring to these outreach events as well. And then another picture from another sexual health resource fair we did on campus. This was a really fun collaboration. So these are two capstone students from the Race, Ethnicity, Gender, and Sexuality Studies program on campus that were doing their internship with us. And they came up with this really fun talk dirty to me where people could come up and ask a question, and then they got to take a cute little succulent with them. And so we thought that was really, really fun. And this was one where I think we had like maybe some like extra funding to do this. We're not always able to do really fun stuff like this, but it is nice when we have like students that are excited about doing it, and then we have the funding to go with that. This is at National Coming Out Day and the Cookout. These are two events that are hosted by the Gender, Sexuality, and Sexuality Resource Center on campus. We've been able to partner with them over the years, which has been really great. Again, with our MPOX grant that we had a couple years ago, we were able to go on campus and do a vaccine or two vaccine events on campus in their center. So they've just been a really great partner to collaborate over the years. And again, it's really helpful when both me and Annie went there. So we're so familiar with like what's on campus, what's going on. And I think that has really benefited us in these partnerships as well. Oh, let's see if we can play this. So this is actually a video that some students developed for us. It's really hard to find our clinic because we are in a large government building. And so they put together this time-lapse video for us. So, and we actually, I think we either have this one or another one on our website still so that people can help find us. So yeah, just another fun thing that like came out of a community partnership and collaboration that, I mean, we may not have done otherwise. I still don't know how to make a time-lapse video, so probably would not have happened. All right, so skipping ahead to some of our community partners that serve folks that are LGBTQ+. We have the Chippewa Valley Community Center. So they have a physical space in our community, which is really nice. We partner with them sometimes on events like Pride, but they also have some of our supplies like condoms. We have sharps containers that they are able to give out to the community as well. So yeah, so they give out our supplies, they distribute information about our clinic and about the services that we offer. And then we have two really awesome bars that host drag bingos. I think we have drag brunch now. And then we've been able to do some outreach testing events at those places as well. And they do have condoms of ours. So again, getting those things to the community where they're needed. Oh, and just a couple fun pictures again from Pride. My favorite thing, this might be a little bit too much, but my favorite thing is we have our ring toss that we have brought into some outreach over the past few years. All right, I think this is you, Annie.
Now to some partners that we have that specifically serve uninsured and underinsured people. So as mentioned, our clients have a wide variety of needs. So thankfully, we're able to have some strong community partnerships to better support them. Two of the key ones that we wanted to mention today. First, Chippewa Valley Free Clinic. We've built a solid referral relationship with them. If one of our patients needs care, for example, outside of reproductive health, we can confidently connect them there. And in turn, the free clinic refers their patients to us for reproductive health services. They also serve or host a quarterly women's health night. This is where Marshfield Clinic actually is also a partnership here that brings in a mobile mammography unit and staff to provide mammograms on site. At the same time, they also have volunteer providers that join this event to offer general health tests or health visits for and then pap tests as well. So as the Wisconsin Well Woman Coordinator, I'm eligible to help enroll the clients in these services so that the mammograms, pap tests, and their health visits are covered, which is a great connection because it also boosts our numbers in the Wisconsin Well Woman program, specifically for our jurisdiction. So we always have that consistent partnership, and yeah, and it's been working for many years now. So with that being said, if a PAP or there's an abnormal test as a result from one of these health nights, a lot of their clients are referred to us for a colposcopy and then follow up at Marshfield Clinic in Eau Claire for additional breast diagnostic screening. There was even an instant where we worked together to complete a LEAP procedure at the Chippewa Valley Free Clinic using our equipment here at the health department and then one of their volunteer providers. Abby was a huge supporter in that and was able to have that connection. So that was a great example of how we make sure the patients get the care that they need without unnecessary barriers or delays. And then North Lakes Community Clinic, as they've grown in the area, they've become a strong referral option for our clients who need follow-up or more comprehensive care. Our medical director practices at North Lakes as well, so it makes coordination even smoother and helps ensure continuity and care for our clients. All right, now partners that address socioeconomic needs. As mentioned before, our community health worker does a lot with this population. They've built very strong relationships through the HIV grant that we were awarded. So throughout that work, they partnered closely with several key organizations, those that work especially hard for people experiencing homelessness. One of those partners is Bridging Healthcare, where they collaborate on outreach efforts and provide rapid HIV testing there. They've also worked closely with the Eau Claire Community Haven House and the Sojourner House, offering testing, helping connect clients to needed care, and providing hands-on support, whether that means making a phone call for a client or helping them navigate the right program or health service. And in addition, the Department of Human Services has always been a strong, reliable partner for us. We're fortunate to have them in a close working relationship, actually sharing the same building with them and regularly referring our clients for a wide range of needs, but especially those who require additional mental health support. And they're also an excellent resource when we have questions related to mandatory reporting.
And then talking about some of our partners that have shared goals. So we are lucky in our community that we have multiple places that provide sexual and reproductive health services. So Planned Parenthood is one of them, and we do a lot of kind of back and forth referral. It's also nice that the nurse practitioner that works there used to work at the health department, so we know her very well. And that again helps. Having those relationships always helps. But they provide some services like gender affirming care that we do not provide in our clinic. So having that referral source. We also do host events together. When we had, again, the Mpox vaccine, we were able to host some vaccination events at their clinic, knowing that their clinic served some of the population that we were trying to reach. And so hosting those events there so we could bring that vaccine to them was a really great way to work on that grant, and then collaborate when we have other shared grant objectives. So right now we're both working on our HIV prevention grant. So kind of working together on some of those things so that we're not both trying to do the same exact stuff. And so that's been really nice too. Vivint Health has been a wonderful partner over the years. Our clinic provides HIV testing. We provide HIV PrEP services. And we also have our 2 HIV partner services providers in our region that work in our clinic. And so having those strong relationships with both prevention at Vivint Health and their case management has been really wonderful to make those referrals, make those warm handoffs. There have been times where they have had staff in prevention there that couldn't do blood draws. So when they would have a reactive test, they would call us up and be like, hey, can I send someone over for a blood draw right now? And just having, again, that communication and those relationships has been really great over the years. And then Bolton Refuge House and Family Support Center are 2 organizations that work on sexual violence prevention and sexual assault advocacy and intimate partner violence advocacy. And so these are partners we've had over the years. Again, when we had grant funding to do things like sexual violence prevention, we had really formal relationships with them where we applied for grants together. And that has built a foundation where even though we don't have that funding anymore, when we need to work on projects related to those topics or when we need to make a referral, we can say, hey, I know this person, Amanda, that works at Family Support Center. Let me get you connected with her. All right, so now that I've talked all about some of the partners that we have, we're going to talk about some of the strategies that we have used over the years for developing these partnerships. So I think I've mentioned a couple times how we try and leverage existing partnerships. So knowing that within our health department, we are a little bit larger. I think we have like 50 to 70 people working in our health department. And so knowing that someone in our health department always has a connection to someone else in the community. So being able to leverage those things and really just look at our networks and knowing who's who in the network and being able to get connected and get like that warm connection from someone else was really, really helpful. And I think it sets like a strong, trusting foundation when you are able to do that. I know I talked a little bit about finding your person, your champion, the one that's going to have the time, the energy, and the passion to do the work with you. And that is so important. I mean, I've worked with so many people over the years and like so many different school nurses, and they don't always want to call me, right? So there are some school nurses that are like on it. They'll text me, they'll call me, and others that don't. So knowing who your people are and the ones that are going to reach out and going to do the work with you. Prioritizing partnerships that focus on priority populations. This, I mean, it really just, again, comes down to the time and the capacity and knowing that you're not always going to have the capacity to partner with everyone and being able to prioritize the partnerships that really are focusing on the work that you are doing. This is where, so the having partnerships at all levels of engagement. So platinum level partners, those are the partners you're going to be hosting events with like once a month. And then there's going to be like the bronze level where maybe you're just sending an email to them a couple times a year to maintain that connection. Just knowing that engagement at all levels is still partnership and that it is so important to maintain those partners at whatever level you can. Collaborating on grants and other funding opportunities. This is like going to be so key moving forward with changes to public health funding. I think really looking at what are other opportunities where we can partner and we can work with people and apply for grants together and work on grants together is going to be really, really important. And it's something we've done in the past and hoping we can continue to do that in the future as well. And that's how our work is sustainable and we're able to do it. establishing informal and formal connections. So like we just got an academic, I think it's called an academic health partnership with UW Eau Claire. So we signed this big fancy contract. So that's an example of one way we're formalizing some of our partnerships. And then those informal partners, again, where maybe you're just on the email list, but I count it as a partnership. You're staying in the know, you're staying involved, you're getting the intel, like Dr. Zapata said, you're getting that intel. Identifying the common barriers, gaps, and areas for improvement, like shared values, getting to know the organization, getting to know the people that you're working with, and really finding what is going to be the topic that you can work on together, or figuring out what's going to work for you all. And then being consistent, which it's hard. We all have like a million emails and a million meetings and a million WEDS cases to follow up on. But doing our best to be consistent with our partners, showing up for meetings, sending follow-up emails, doing all the things that we can to really be consistent and show up in those partnerships. Ooh, another mentee question.
I think this is our last mentee question for, or nope, we have another one, but. So just thinking about everything we've shared so far, what successes do you notice? What benefits might strong partnerships bring to your own community? Yeah, we'd like to hear what you have. Build trust, community knows more about what we do. That's exactly right. So just going on. Oh, yeah. Oh, yeah. Better continuity of care for client, faster treatment, building community awareness, community education and outreach, clients staying engaged with their care, get what they need, common goals will benefit all, expedite client care, help upstream support, equal care. These are all great. Multiple people working towards common goals, like we shared about working with each other, follow-up care, consistent messaging, smoother process. Provide resources that we don't have the capacity to give. Yeah, these are all great. Invite to collaborate with other organization projects and reach new people. Yeah. Thank you for sharing. So when we talk about partnerships, it really comes down to the fact that we simply can't do this work alone, and we don't have to. So thinking about things like further reach, filling gaps in care, like a lot of people have mentioned, partnerships help us reach people we might not otherwise connect with. Every organization has limits and there are always gaps in care, but when we team up with other communities or others in the community, those gaps start to shrink. Continued care is supported by community partnerships. Instead of someone having to navigate everything alone or start over every time they access a new service, partnerships help create smoother transitions and more consistent support. Greater consistency enables lasting community events. So when organizations align their efforts, community events and initiatives aren't just one-time efforts, they become sustainable with ongoing resources people can depend on. And then the mutual benefit of lightening the load. Again, we share responsibility, resources, expertise, which prevents burnout and strengthens everyone involved. And then ultimately, having all these things will build trust and positive outcomes through our partnerships and within our community. Oh, did I go backwards? Yep. Okay, so this is the last one we have. We know that finding and building partnerships can take time and effort, easier said than done. So what are some important things to keep in mind as you seek out and develop partnerships? At least with just this next week, name one thing that you can do to focus on these community partnerships in your community.
Oh, I like that. I like to thank them. I think sometimes I'm guilty of not reminding our partners how much we appreciate them and the work that they're doing.
These are all great. I think the Finding Champion one has been a huge one for this lesson learned so far, but also just thanking your current partners and reaching out to your colleagues who you may not know who work with already. So just using your current partnerships to expand, but staying consistent is great. Okay. So with that, we'll go with lessons learned. Um, oh. Some of the big lessons we picked up along the way. First, it's really important to prioritize. There are so many great people and groups out there, but you can't build deep partnerships with everyone at once. Focusing on what matters most helps you make the most of your time and energy. Second, it takes time and capacity. Partnerships aren't something you can rush. They grow slowly as you build trust, show up consistently, and follow through. Another thing we've learned is to be okay with change. Um, Sometimes priority shift, yours, your partners, or the communities, and that means the partnership might shift too. That's okay. It's just part of working together. Staying organized. Our work can get busy, inboxes can get swamped. Scheduling time for follow up and keeping contacts, for example, like in a spreadsheet or some sort of follow up calendar that you keep just on hand can be helpful. And finally, keep trying. Finding the right person to connect with or the right way to work together often doesn't happen on the first try. But if you keep putting yourself out there, you'll start to build a real momentum. All right. So before we end, we just wanted to talk a little bit too about how our social media and networking has really helped us have such strong outreach materials and good internal networks, especially around communication and social media. So we have a communications team actually at the health department that gets together every month to talk about what's working for each division, including how our social media posts are performing and what people are engaging in online. So this collaboration has been huge for us. We tend to grab new ideas from each other. And then we highlight different divisions depending on what's relevant. It gives us consistency in our messaging, but also lets us reach different audiences in a way that makes sense for them. So we share an Instagram and Facebook page. So a lot of the advertising and outreach events, the marketing materials that we do for those, we actually create within our own health department. So now we'll just do some fun examples of our work and then some of our outreach promotion ones have helped us connect with our clients, community partners, and audience. So on the left here, we have a World AIDS Day post that our community health worker helps us create messaging on. We offer information on the importance of testing and then seeking awareness, education, things like that. On the right here, we have a example of our post about condom awareness. So we always tend to include our link to the health department, specifically our family planning clinic page, where they can find information on how to schedule an appointment or a phone number or ask questions. And then just going left to right. So on the way left, we have another example of our STI post. Again, always sharing information on our clinic and then where to find us. In the middle, we share more of a statistic. And then on the right here, we kind of incorporate St. Patrick's Day and still staying consistent with Condom Awareness Month, and sexual health. And then on the left here, another HIV awareness testing type of post that we have information on where to find testing locally. In the middle here, we have a picture of another STI post with messaging. And then on the right here, we highlight cervical cancer awareness month, and then scheduling a PAP and how to do that and where to do it. We've also, with our MPOX funding that we mentioned before, have had the opportunity to create a grinder, like a grinder page for us to be able to have our ads on there. So we have two examples of what we use for MPOX vaccination and awareness. And then we also have another STI post, and usually where they're able to tap is usually on the bottom. They can just tap right there and it takes them right to our website. And then we had a post about HIV PrEP. And then our stickers, which we have created our team ourselves, as pictured in the other when we showed pictures of us at outreach events. They're usually held in like the little buckets, and students are able to grab and just spark conversation. Take one for a friend, and we always incorporate our number somewhere as well as our QR code. And then lastly, we have our magnets. So we also bring these magnets, part of our swag for our outreach events, which have our logo on them, QR code, our phone number, and just brief information on what we can help you with. And then always just nice to look at because it's just eye-grabbing.
They really are. Canva's the best.
We love Canva. All right, we just wanted to share some examples, so thank you for listening. We have our emails up here, but if we have enough time, we would take some questions too.
Have 12 minutes. So people have questions, please feel free.
So you talked about your STI presentations where you go in the schools. I have like twofold question. What age group do you guys do? I don't remember what you said.
Yeah, so our,
I'm sorry, I forgot to say,
Yeah.
kind of repeat the
Yeah.
question.
oh, yeah, so
What age group for STI?
yes, what age group for STI presentations? I have mainly done high school and I think it's their freshman health class. I have done one middle school health class. I was not admitted back, so I don't know. I don't think it was me, it was definitely them. But I think maybe that was just like a little young. I mean, young for the school district, not for the students. The students were like on it, asking questions. They were wonderful. Yes. So
Or is it more like this?
yeah. So when we're in the school setting, generally it's more of a like lecture type where we're asking questions and getting them to answer questions, but less activities. However, in other settings that we're in, because we have more time, when we're in the school setting, it's like 40 to 50 minutes, I think, if that. So we got to be really quick, and activities just take a lot of time when you're trying to cover a lot of content. In some of our other settings, where we're working with the youth over a course of like 4 to 6, 7 different days or different sessions, we are incorporating more activities. We've used a lot of different curriculums over the years. The 3 R's, rights, respect, and responsibility from Advocates for Youth, is one that I use frequently. They have lots of wonderful lesson plans that you can use from K to 12 and beyond. So that is one that I use, and they do have a lot of activities built into it. We also use HIP Teens, which is a little bit older curriculum, but it is evidence-based. So that one is wonderful too, and they have a lot of activities built in as well.
Of that, have you had any pushback from parents doing STEM in school? So how did you overcome?
Yes. So not, I mean, haven't explicitly heard that it's parents pushing back, but I think administration just being a little more conservative. Right now, I'm actually experiencing that with one of our groups that we were trying to get together. It's wasn't a typical setting, but it was in the schools. And so they were working on kind of like an opt-out permission slip type of thing, sending home to parents. And so that's one way. We're also we ran into that at one of our school districts where I can come on site and provide sexual and reproductive health services. However, they would need permission from the parent for me to see their child during the school day, which was a big, huge conversation. And I respect that that's their choice as a school district. So yes, it's not easy in some schools. I think when it comes to like our sex ed, like one day spiel in health class, I mean, it's a part of the human growth and development curriculum. And so that's how we've kind of gotten around that. And most teachers feel confident and comfortable, and they honestly tend to really like when another person comes in and talks about that stuff. But when it has come to some of our more involved curriculums or lessons, that's when we've had a little bit more pushback. And it's really just figuring out what's going to work. And sometimes it's just not going to work. And that's been unfortunate. That's happened a few times in the last few years. But yeah, I mean, like I said, permission slips, kind of that opt-out approach is one way. Yeah.
Gone into the ground protection center, then what did that look like? What did you do?
Yeah, so with our juvenile detention center, we have, like I said, in the past, we've had some adolescent health and sexual violence prevention grants where we were able to purchase different curriculums, train staff to utilize these curriculums. So we did a lot of programming, sexual health programming, consent, talking about a lot of different topics related to sexual health and sexual violence prevention. So we did a lot of that work. We also had a nurse that has previously had medical, I think it was the Medical College of Wisconsin, had medical students that would work on different projects in the juvenile detention center. One project that they worked on was when young people would get their intake at the juvenile detention center and their health intake. They included immunizations in that, and that was what this medical student was working on. So if there were immunizations that were needed by this young person, then we were able to make that happen. So that was kind of one example of a project. Like I said before, I can go see young people up there for their sexual and reproductive health needs as well.
Back to the school, but I was wondering who have been successful schools.
Yeah. So there have been a few. So they're asking about champions in the school districts. I would say it has changed over the years, but a lot of great work with school nurses because nurses are the best. Shout out to all the nurses. And then also in the past, I've worked with some guidance counselors actually that have been huge advocates. One in particular I'm thinking of was in a very small community in our county. And we worked on a sexual violence prevention grant together, and we worked on updating their school goals and their like bullying and harassment policy to make it more inclusive of all people. And so they were a huge champion at that school. And I think for them, it was because they had the passion for it. Not every guidance counselor is going to want to work on something like that. Other folks that we've had, so in our major school district in our county, they have what's called System of Care, which is actually through the County Department of Human Services. And so they have staff that are county staff placed in the school. They have been a really great advocate as well. I think I mentioned already social workers in the school that has been really great advocates. Health teachers have been awesome. I'm trying to think if there's anyone else. Those have been kind of the big ones that I have worked with over the last several years. Yes.
While you're swag, well,
Where do you order from? What funding?
We use a variety of different funding. Well, first, we never really order from Canva directly. We usually have a partnership with Digicopy, which is a local place where they do printing for us at a discounted price. Funding comes from everywhere if we can get it from as far as like within our clinic Title 10 funding. We also, since Wisconsin Well Woman Program is in the clinic technically, we were able to use their funding. So just kind of a variety of funding. Sometimes communication team has additional funding, so finding funding within the health department. Yeah.
I think we've also used our UW Eau Claire printing services is also really cheap. So
Yeah.
that's, I think, one of the other places we
Yeah,
print.
that's where we get our stickers printed and then, yeah.
Mhm.
Yeah.
Yes, you can use Canva.
Yeah.
It's expensive. Yes. Yes. Oh, yes. Thank you. Yes. The question was, where do we get our like swag and other things printed?
And then finding funding.
Oh, and how do we fund it? That printing.
Did we answer?
Yes, you did.